Some others talk about being kind of fatigued over this issue, having dealt with it for 7 years, because I've been looking at the issue of people not being able to afford health insurance since I was about 10. That's when my dad's best friend died. Levi Herring, over in an encampment where my dad grew up, worked in the timber, worked as an outfitter, but he had type A diabetes. And as his health deteriorated, he had a harder and harder time making ends meet. And towards the end, he was making the decision weekly whether to put food on the table for his son or to buy the medicine he needed. He died when he was about 43 years old. And I've been watching this happen for the rest of my life in Wyoming. The Department of Health estimates 24,000 people would receive basic access, basic insurance through this program. I do think that number is growing, and it's growing in places like my hometown where I grew up in Rock Springs, places like Gillette, places like Kemmer, where the energy industry is struggling. And there used to be a fiscal argument from the state's perspective against this. There's not any longer. You can have ideological stances against federal funding, whatnot. I don't disagree with you that you don't want socialized medicine, but if you don't have insurance, you want something. And it's interesting to me talking to more and more people around the state. The folks who work at your grocery store don't know what an FMAP is. But as they can see other people in other states having access to basic insurance, more and more people are starting to understand what you all are stopping them from having effectively. There's a lady who works at the dollar store in my neighborhood, or she used to. She got cancer, and she's far from a policy expert. But after getting a $250,000 surgery and treatment, and now she has to pay hundreds of dollars every month out of pocket because she went to the state and applied for Medicaid and was told that her construction worker husband makes too much money for them to qualify, and she's just going to be stuck with the bills. You're just flabbergasted. She might be here on the call today. I don't know. I told her to come. She said, I worked my whole life. I did everything right, paid my taxes. And when I asked for a little bit of help, she didn't ask for cancer. She had a tumor the size of a grapefruit in her body. But more and more people are starting to understand what Medicaid expansion means and what we don't have. And yeah, it's not the perfect solution. It's not the end game, but people are dying right now. Those 24,000 people who would have eligibility to receive this, those are the people who are getting sick and wondering whether they're going to put food on the table or go to the doctor. And people understand too that the legislature doesn't have to deal with these questions. They know that the people up here in the Capitol, y'all aren't worried about getting sick because you're going to have insurance. And so it's kind of this perspective. Every time you turn this down, telling the people of Wyoming, I got mine, but forget about you. So I'm asking you to pass this bill. Please pass it out of committee. Have a conversation on the Senate floor about it. Nobody's asking for anything that you all don't have. I stand for questions.
Thank you very much. Questions, committee? Senator Bouchard.
Thank you, Mr. Chairman. I hear the push, but I've actually been watching a Medicaid fraud case that it's almost like nobody cared. We threw away a lot of money, and there's still property that's being held that should be sold to repay the state back the money. And nobody cares about any of that stuff. And I think what I look at is the Affordable Health Care Act. It didn't turn out to be so affordable. And the push was they dropped Medicaid out of that whole equation. And now we're sitting in a position we're going to push this so we can expand. I just don't want top-down medical care anymore. This is getting ridiculous. To where, and look, I'll even talk about a case where even when I had insurance and we pay $5,000 for a doctor to tell us that we poisoned our daughter with Tylenol, and we had to take her out of the hospital and take her to another hospital. And to this day, my wife says, I just can't believe we spent that kind of money for that kind of diagnosis. I think there's a whole lot of other problems that need to be fixed. We're just never talking about those problems. We're not talking about how the costs are keep increasing. We're not talking, and this isn't going to do that if we don't have oversight. All we're going to do is throw more money at the problem. And we need to fix these problems that are happening over in the beginning of the healthcare. I mean, look, we've got Affordable Health Care Act. We've got people who now are paying premiums that are through the roof. In my time in the Senate, we had a bill to put a tax on another insurance that doesn't even deal in health, to tax them more on incidental insurance to pay for the increases in the costs on Obamacare. And I'm just going, we're going to hurt incidental insurance by charging them more, so we can offset the costs on the premiums on healthcare. That was a bill that came a couple of years ago. We just keep saying, how are we going to throw more money at a problem, but we're not looking at how we're going to control these costs. So that's what I'm not hearing here. All I'm hearing is let's throw this money at it. We're going to get ourselves stuck in a system we can't get out of. And we really have a lot of power at the state level to fix things here. We're not doing it.
Mr. Chairman?
Comments? Go ahead, sir.
Sure. I'm not quite sure what the nugget of that question was. It seemed like a bunch of what about this and what about this and what about this. Yeah, premiums are going up. That's why a lot of more people can't access healthcare. That's why a lot of more people are dying who need insurance coverage. You know, if the state has a lot of power to fix problems, do it. Like I said, let's go. And in terms of throwing money at it, the state's actually not throwing any more money at it. As Senator Roth has said, these are tax dollars that people in the state of Wyoming already paid to the federal government that are funding Medicaid programs in other states, but not in Wyoming. And like I said, people are beginning to learn what we are not providing them.
Thank you, sir. We're going to go ahead and move on to the next
Thank you.
testimony.